Alright, in this video I'm going to review the basics of how to go through care guidelines for patients that are considered high risk to satisfy our PCMH and NCQA requirements. So first of all, I've selected a patient who will be considered high risk. In this case, it'll be a diabetic patient who has a hemoglobin A1C greater than 9. So this patient has an encounter created for today, and we've selected an internal medicine specialty and nurse visit. It could be family medicine as well. And you'll notice that on the home page you've got this blue text that you may have seen before. It says Care Guidelines. You're going to select this text by single clicking, and you'll see a new pop-up that shows basically a blank screen. You're going to want to go ahead and cycle through until you get to clinical guidelines. This will probably be the first one that pops up for you, but I had it on some other window initially. And in this case, we're going to go ahead and add a new care guideline for this patient, and it's going to be for diabetes. Okay, and you have to put a diagnosis in here. So we'll select from my list. I'm just going to go down and select diabetes and add it. Okay, now these are the guidelines. We're going to eliminate dental exam and depression screening from this, but otherwise this is the active list that we're going to use. So the next thing you'll do is you'll click Save and Close. And you'll notice now that you have diabetes listed here with 11. There are 11 outstanding items here that are being counted. Now, the thing you'll notice is if you click this icon, it'll say that the only things that are being counted in this number are things that have a status of not prescribed or due under them. The ones that are blank are not being counted, and we'll review each one of these individually. Okay, so the first one is aspirin. The patient should either be prescribed aspirin or there should be a reason for not taking aspirin. And so if the patient already has aspirin on their medicine list, this will already be satisfied, and you can move on. It'll actually say that the patient is prescribed this medicine. Let's say for some reason this patient has a reason not to be on it, and so we'll say exclude, and we'll just click out of here. There are several exclusions that are listed here. Let's see if they've got one for diabetes. Let's just save and close. So on the aspirin, again, we're going to say, we're going to make it a blank space, and we're going to update it, and that'll eliminate it from there. So in the future, we might use the exclusion, but right now we're going to use the blank space. Okay, so for dental exam, we're going to say that this patient already hadn't completed it, even though we're not technically using these. These will be eliminated. So depression screening, let's say it was completed, and you can put the date and then click update, and it'll drop down to the bottom as completed. Alright, dilated eye exam, you'll need to go out of the window here and go into the patient chart and see if they've had a dilated eye exam in the last year. It'll be under the category for ophthalmology, or if it's been there a while, it might be under the category for other consults. If you can't find it, you'll want to contact the patient and see if they've had one, and then get a faxed report. And once you have documentation of a dilated eye exam, you'll select completed elsewhere, put the date in, and then update, and then that'll satisfy that one. Home blood sugar monitoring, this is something you'll want to do. This is something you'll want to do when you're contacting the patient by phone, and so you'll satisfy this either by leaving it blank, or you can go ahead and click recommended and update it, and now that's going to be satisfied. The foot exam, similarly, you'll go back through prior encounters and make sure they've had one foot exam within a year. If that's happened, you'll go ahead and click completed, and what date the most recent one was completed. GFR, this is a lab value. If the patient's had labs done in the office within the last year, that includes a GFR, it'll be already listed here from the lab. If it's from an outside lab, such as a fax, coming in from somewhere else, you can select the date as completed or performed elsewhere. We're just going to say completed here and update it. Again, hemoglobin A1C should be done specifically in these patients because they're being selected by their A1C of greater than 9. So you go ahead and click completed, select the date it was completed, and then update. And then influenza vaccine and pneumococcal vaccine. Once you have these listed in the patient's chart, these will go away. So if you need to enter a historical date for these, you can do that. Or you may have to put declined, but that all has to be done from the immunization module, which I'll show you here in just a second. So if you click out of here, go into your SOAP section, and then go into adult immunizations. Let's go ahead and historically enter the influenza and pneumococcal. And let's just go ahead and say, well, let's go ahead and give it a date so that it counts. And we'll list the sources unspecified. And we'll save all of these. And then we'll click out of this and go back into our care guidelines. And then if you scroll down there to the bottom, you'll see that influenza vaccine has been counted, and for some reason the pneumococcal vaccine just goes away, but it is no longer counted in the numbers here. So the next thing is the lipid panel. Again, it's a lab value. You'll select completed and the date it was completed, and you'll click update. And then these other 3 things that you see here, review blood pressure control, smoking status, and weight. You can click their goals, and we'll add more goals for blood pressure control. We'll say the patient was counseled, and we'll update it. Smoking status, smoking cessation is the goal. It's not indicated because let's say this patient doesn't smoke. We'll update. And then review weight. Let's say that we want weight reduction. Patient was counseled on the phone, and we're going to update. And then the last thing is a microalbumin here. So this one is, we say we completed that as a lab value as well. And so now we only have one left, and of course that's because the aspirin is not prescribed. If we're going to say the status here, just for completeness sake, let's just go ahead and say it's prescribed and update. And now we've satisfied all of our care goals. If the patient has an exclusion, we're going to have to figure out how to make that work so that when you click excluded, you're able to work through that. But for now, this kind of satisfies the goals. The next video I'm going to show you will kind of go over how to do some screening questions if you want to use those for your interview with the patient. And then we'll show you how to create a document that we'll kind of summarize everything we did today for the visit they're supposed to have coming up. Okay, comment below if you have any questions, and we'll upload the next video that'll show you how to do those things. Thanks.